The surge in Covid-19 cases here in France is raising alarm. Cases are up 150% on the previous week, 18,000 over the last reported 24-hour period. Medics say the Delta variant is at the centre of this rise in cases. Prime Minister Castex is warning that if necessary, new freedoms afforded by the health pass could be reined in if necessary.
%96 de ces 18 000 cas, de tous ces cas qu'on constate de plus en plus nombreux, n'étaient pas vaccinés. Le monde est confronté à une quatrième vague. Elle arrive. Nous devons réagir. Et en même temps, la clé, on la connaît, c'est pas tout à fait nouveau, mais la contagiosité de ce variant Delta nous oblige encore plus, il faut vacciner.
So the health pass launched today, being used today, people getting access to the Louvre and places like that because of the health pass. But the warning from Prime Minister Castex that if needs be, it could all be reined in. And of course, that fourth wave is what he's talking about, which we are told is already with us. Let's bring in for analysis from London, Joseph Downing from the London School of Economics. Joseph, thanks for being with us. I'm wondering what your take is on the situation here, because clearly there is this rise in cases and at the same time this granting of freedom due to the health pass.
Yeah, I mean, it's really, really problematic and puts France and Castex in serious trouble, really, because he's offering society a key to avoid another lockdown, and a lot of society is rejecting it. We can see this huge cross-national variation in terms of both vaccine hesitancy and vaccine uptake. Countries like Malta and the UK have had significant levels of vaccination. We can see in the UK cases are sky high, yet hospitalisations and deaths are extremely low. This is affording the UK government a bit of wiggle room. However, now that the Delta variant is taking off in France, it's extremely worrying that they have much lower vaccination rates, and not just low because there's a lag in it being done, but low because people are very reluctant to take it up. There's also an issue here with fraudulent health passes. You can buy a fraudulent health pass off of social media for €300. So even with that, even if people have a health pass and say that they're vaccinated, they may not be. And this is really quite serious.
Indeed, this health pass then, by the end of August, some workers could face the sack if they don't have one. That would be an extreme case. I think there's 2 months leeway in order to actually get it sorted, but they could face the sack. The CGT union's already spoken out against the idea of the health pass. Philippe Martin has been very vocal about that, the leader of the CGT union, the most extreme of the unions. Do you see here a continued problem with this idea of having the health pass?
Yeah, I mean, and it really does show the difficulty in this situation that we find ourselves in. I mean, the CGT is also very critical of lockdowns and job losses and possible pay cuts and people being made redundant because of lockdown measures. But at the same time, they're critical of a health pass that can enable society to open up. The problem is, in the French context currently, we have too many critics and not enough people offering solutions. Castex is offering a solution and people are rejecting it. And this is really, really quite serious. I'm concerned that many people are going to take the easy route and pay the €300 to get a fake health pass. So it's currently been broken by the Le Parisien newspaper, and I'm picking it up in my research on social media, that healthcare workers in France are actually selling fake health passes of €300. You go to the nurse, they take out a vaccine, they put in a batch number, and instead of injecting that into you, they inject it down the sink. So we could have a situation where many people are just going to go and see that €300 as a worthwhile investment, and thus the health pass, even then if it is initiated, becomes useless, really.
Indeed,
also,
Joseph.
we have a massive issue here.
Confirming what you're saying there about that issue about the false passes, there are investigations underway, so you're spot on and correct in what you're saying there, Joseph, completely. The law is going through the French Parliament this week. There have been over 1,000 amendments tabled already. Do you see this as a good sign that at least here we're seeing some kind of positive debate and maybe attempts to change and hone things to make it more acceptable and more effective?
The thing is, possibly, but the issue with democracies is that debate is not efficient. And actually, the more amendments and the more debate you have, the less efficient not only the legislative process becomes, but then the less efficient the legislation becomes that comes out of that consultative process. And this is where we can see you know, democracies that have more of a concern for human rights and personal privacy suffering a lot more with COVID-19. I mean, there's more factors at play, such as an aged population, but the fact that this is becoming such a fraught issue, and they're right, people are right to interrogate what's going on, right? We have a situation with the UK government where, you know, they're putting in travel restrictions that don't seem to have a scientific basis. So clearly, governments, as they always do, will abuse their power. But it's extremely difficult to see a way out of this if people also don't turn the line and become vaccinated.
Indeed, political decisions often versus medical decisions, and often the two don't meet, and politicians making decisions because they want to get re-elected and keep the people happy. It is a vicious circle. Joseph, as ever, thank you for joining us. We always appreciate your take on matters and your analysis. Joseph, joining us there from the London School of Economics. Joseph Downing, thank you very much indeed, sir, for being with us.